With the stroke of a pen, the commissioner of the state health department today allowing women to access birth control without a prescription at pharmacies across New York. With the governor by his side there, he signed a standing order that authorizes pharmacists to dispense self-administered hormonal contraceptives, including pills, vaginal rings, and patches. It will likely take a few weeks before this is operational, but this is now a change in effect. Tonight we're hearing from two key voices on this topic to begin the show. In a moment, I'll talk live with a pharmacist who is board chairwoman of the Pharmacist Society of the state of New York. But first we're hearing from Dr. Eugene Heslin. He is Chief Medical Officer and First Deputy Commissioner for the State Health Department. And Mr. Heslin joins me now live. Thanks for your time, sir. And I wonder if you can just give us sort of the background as to how this came to be, why the State Health Department decided to make this move today, and what is most important for viewers to understand about it.
Thank you for having me on the show today. First, appreciate being here. Actually, this is a collaboration between the State Education Department and the Department of Health. Last year, as you know, we've been having lots of issues with women and their ability to receive contraception, frankly. And so the governor worked with the legislature to put through a law that essentially said that women could go into a pharmacy and receive self-administered hormonal contraception. There is actually an order. What Dr. McDonald signed today was a standing order that allows any woman to go in to receive this. So they don't have to have an individual prescription, but they need to still go in. They fill out a form. There's a series of questions that need to be answered. And then what happens is, the pharmacist then makes the decision with the patient to be able to figure out what type of hormonal contraception they want to be able to dispense. So this is something that got put in legislation last year and was put into regulation by State Education Department on March 12th. And so we worked with State Education Department developing the tools that the pharmacists would use to be able to aid in the appropriate decision making that would be necessary to be able to make sure that this is prescribed safely and dispensed safely for patients. We think it's a good thing. Anytime we can increase access, it's a good thing. We think at the Department of Health, pharmacists can actually do a lot more than they do. And we're really excited that we're trying to continue to increase what a pharmacist can do to make sure that the entire healthcare system works better.
There are some people who have seen this news today and have wondered if this is removing doctors from the equation. Can you assure everyone that the safeguards are there and this questionnaire and the conversations that will be happening with pharmacists, that this will remain safe?
Yeah, it's very safe because this is being done in 28 states already. We're the 29th state. And so this is not something that's just brand new or out of the box. There is an order that's written. It's written by the Commissioner of Health for all New Yorkers or people even visiting New York. So that is safe. Pharmacists are uniquely trained to understand risks and benefits and harms and counsel patients on this all the time. So what happens with the questionnaire is the patient, the person, would identify the things that they have or don't have, and then the pharmacist would go through an algorithm to be able to help the patient understand where their risks could be. If a pharmacist doesn't feel that it's safe to prescribe or dispense for that matter, then what will happen is they would refer them back to their primary care provider or family planning office to be able to better understand a more individualized approach. So we don't see this as being dangerous at all. We actually think it's quite safe.
Dr. Eugene Heslin, Chief Medical Officer and First Deputy Commissioner for the New York State Department of Health. Busy day for your department. Thank you for sharing some time with us.
Thank you.
So during today's announcement about this standing order for birth control, Governor Hochul said it is a, quote, new era for New York State, for the women of our state. And she said this about making it easier for women to access reproductive health care. She says it's the opposite of what we're seeing in some other states.
Any woman can walk into a participating pharmacy and choose the birth control method that best suits her needs. And this will dramatically increase access to this for women, particularly at a time when women are feeling discouraged and not listened to and powerless.
And we want to continue the conversation now with Heather Ferraris. She is board chair of the Pharmacist Society of the State of New York and joins us now live. Thanks for your time as well. Let me just get your reaction and your organization's reaction to this new role that you'll be having across the state.
Thank you for having me. The Pharmacist Society of the State of New York is really excited to enter into this partnership with New York State through SED, the New York State Department of Health, and obviously the governor's office. We're very prepared to meet these needs, and we look forward to rising to the challenge of taking care of our patients in a new and exciting way.
I know that there are a lot of specifics to this, and we'll kind of learn that as people are going along. But what are the things that people should be most paying attention to in terms of who qualifies for this and what types of birth control will be available this way?
So all women in New York State will qualify for this. The commissioner has signed a standing order, which in essence acts as a prescription for any woman that the pharmacist, and it has to be a participating pharmacist. Not every pharmacist will choose to do this. So that's something that patients would need to talk to their pharmacy about, whether they anticipate participating in this program. But it's really beneficial to all of New York State women to have easier access to hormonal contraceptive, which could be a pill, a patch, or a vaginal ring that's inserted.
Obviously, with a medication like this, you want to make sure that someone doesn't have, I don't know, allergies or some other medical condition that could, react poorly with it. Can you assure everyone that the pharmacists who participate in this will be going through all of that thoroughly to make sure that this is done properly?
Absolutely. The commissioner has provided some documentation that offers a patient self-assessment test. So the patient will go through and answer a series of questions to help assist the pharmacist in making that decision. And then the pharmacist would go through and triage and speak with the patient about which type of birth control or hormonal contraceptive would be best for that situation. In the event that the pharmacist, in their professional judgment, doesn't feel it's safe, they always have the option of referring back to their primary health provider or a family planning group to make that call in the event the pharmacist is uncertain.
And unless someone requests it not be, the information is automatically sent to the person's primary care doctor. I read that today. I only have about 30 seconds left here. How quickly will this go into effect? Obviously the announcement today, but it will take a few weeks, I assume?
It's effective today, so if some of the pharmacists has already done some of the training that satisfies the commissioner's requirements, they could technically start today. I anticipate that within the month that most pharmacies will need at least a week or two to get up to speed and make sure that they've got their staff training and documentation processes in place. But I should think definitely within the next few weeks to a month that you'll see this taking off across pharmacies in New York State.
Dr. Heather Ferraris is a clinical pharmacist in Central New York, board chairwoman of the Pharmacist Society of the State of New York. Thank you for your time.
Thank you.